Hello, Matthew Bell with Alzheimer'sProof.com. Today I wanted to comment on a news item that crossed my radar screen a couple of weeks ago. This actually goes back to August, as far as I can tell, August of 2019, and was published in the Journal of Neurology, which is an academic journal, and then it was picked up by various news outlets. I saw this through a press release from Washington University's School of Medicine, which is located in St. Louis, Missouri, and it reported on the idea of a new blood test that's available for Alzheimer's, or at least I should say is available. It's in the testing phases, but it has been developed and researchers think that it holds great promise, and let me explain why that is. So first of all, what the test does. So you will recall that, and if you would like a refresher, I have a video on some of the causes for Alzheimer's disease, but one of the causes that's often referenced is the accumulation in the brain of various protein gunk. There are two different types of protein that essentially are implicated in this. The first is called beta-amyloid, and the second is called tau. So you have beta-amyloid protein, and then you have tau protein, and between the two of those, that accounts for the various plaques and tangles that Alzheimer's patients' brains seem to be riddled with. Now, the 100% definitive test for this is going to be an autopsy. So there's very little use, obviously, for an autopsy to play in terms of preventative medicine or even in treatment while somebody's alive. It can give you the accurate cause of death after the fact, but it's not going to be too good for medicinal purposes. Now comes a blood test that promises or holds the promise of being able to detect levels of beta-amyloid in the blood. Two kinds of protein in specific, two kinds of beta-amyloid protein are being focused upon, and those are number 40 and number 42. So I take it that there's a whole array of these beta-amyloids, but that 40 and 42 somehow play particularly important roles in the accumulation of these deposits in the brain. Now, what researchers have hypothesized and has since been borne out, at least in early stages here, and I should say the test has actually been going on for a couple of years, and I'll mention that in just a moment, but what the test seems to suggest is that levels of beta-amyloid in the blood suggest an accumulation of the beta-amyloid in the brain. Now, why is the test important? Well, I mentioned that autopsies are the definitive test, and those are no good for diagnostic purposes. So the test right now that is the sort of most accurate test that you can get is a PET scan, Positron Emission Tomography, and a PET scan is essentially the best test that's available. But PET scans are expensive and they are time consuming. So this blood test holds out the hope for being able to test on a wider scale and for far less cost. Those are 2 points. So a blood test would be able to be administered in a doctor's office instead of in an imaging center for one. Now, what researchers discovered was that they compared the blood test results against the PET scan results, and what they initially found was that the blood test was 88% correlated with the PET scan. So if the PET scan saw evidence of Alzheimer's, the blood test detected that 88% of the time. That's the way I'm reading the article. But when they coupled the blood test with a couple of other risk factors, for example, age. And age, your risk goes up with age. After the age of 65, your risk actually doubles every 5 years after age 65. Also, they factored in genetic predisposition. So if you have this APOE4 variant gene in your blood, in your genetic makeup, then you have a higher, 3 to 5 times actually, higher chance of developing Alzheimer's sometime in life. Another risk factor is sex. We've talked about this in other places. It may not be its own risk factor. It may simply be that women live longer and therefore are more likely to manifest symptoms of Alzheimer's and other dementias because of their longevity. But it is sometimes said, and I saw it in the article, that 2 out of 3 Alzheimer's sufferers is female. When they incorporated age and genetic predisposition, they found that the test was 94% effective in terms of matching up to the PET scan. But what they found in addition to that was even more interesting to me, and that is that some of the blood tests that came up positive, those people eventually came up positive on the PET scan as well, which suggests to researchers that the test might actually even be more accurate than the PET scan and able to detect Alzheimer's in its very earliest stages. So recall also that Alzheimer's disease manifests in symptoms, but prior to that, researchers believe that the underlying brain changes may take place as far back as a decade or more prior to the onset of symptoms. Now, one of the benefits obviously is early detection. They want to be able to treat people in pre-symptomatic stages. They feel like once memory changes and other changes manifest, the brain is already so damaged as to almost be beyond help. But another is that the ability of this test in terms of finding people who have this early stage might help in clinical trials for developing interventions. An early version of this test has gone back to 2017, 2016. At that time, some of the articles referenced autoimmune antibodies or autoantibodies, and the idea was that the immune system's response to the accumulation of this beta-amyloid might be able to be gauged. But in a closer inspection of these articles now, in retrospect, they also seem to be describing a blood test that focuses on some of these beta-amyloid protein variants. The idea is to try to catch Alzheimer's disease in its very earliest stages. Now, sometimes this preclinical stage is referred to as very mild cognitive impairment or mild cognitive impairment, and that's sometimes abbreviated MCI. Now, not all MCI does develop into Alzheimer's disease. There are other dementias. There are sometimes traumatic brain injuries and other conditions that also might be prefaced by mild cognitive impairment. It's sort of just a catch-all phrase for a certain level of diminishment of cognitive and other perceptual and reasoning capacities. But again, this blood test is fascinating and holds promise because it's less expensive than the PET scan, possibly more accurate than the PET scan. It is able to be administered more widely and in more environments like doctors' offices and other places, whereas the PET scan is obviously limited to an imaging center, and it's certainly superior to the autopsy in the sense that it holds out promise for being able to help treat and diagnose people while they are still alive, which is obviously advantageous. So please, if you found something of use in this video, please like it, subscribe to the channel. That would assist me in my endeavors. It would give me an indication that the content is being received well, and I appreciate your time. I look forward to seeing you in another video. I invite you to please check out other videos that I've done and check out my website, alzheimersproof.com. Thank you very much.